Hi, so today we're going to talk about us showing our own emotions in therapy with the client. So this is kind of, one of those things where there's not necessarily a right or a wrong. That's pretty much with everything we discuss. But we want to be really careful. We want to be genuine. We want to be sincere. We want to acknowledge and validate their emotions, but we don't want to take that on. And this also has to do with boundaries. So we want to be able to have that boundary, right, with our client so that we can help them. Because if we take on their emotion and we begin to feel that, like say if a client starts to cry and we start to tear up too, because we are very, sympathetic to them, which of course happens, right? We're in this field because we care, because we want to help, and more clients are going to get to us, emotionally than others. We're only human, but when that happens, what usually think about what usually happens, like even in a friend in your personal life, when they come to you with something and they start to cry, and then you start to cry too based on what they're saying. Usually what happens is they stop, and now it becomes about us, and that is not what a client needs in therapy. Right? That's okay with a friend. That's okay in your personal life because you don't want to be a therapist as a friend or to anybody else in your life. Actually, that's a great topic, another topic that I'll make note of. But, when we're in the role as a therapist, we really want to maintain that emotional boundary only because that is the only way that we can help them and remain objective. And, because if we take on that emotion and then get kind of sucked into it in a sense, we now are operating with the more emotional side of our brain as opposed to like the rational, logical, problem solving side. And we don't want that. We can't afford that. And that's not good for the client. So, my recommendation is, you can share it verbally. You can have that expression of empathy, but again, not sympathy. We don't want to take on that emotion because it interferes with the process, and the client has to feel safe in being able to tell us anything. The client has to feel like we can handle it. And that's really important because most people, and personally aren't able to handle really strong emotions. What do people say? I mean, what do parents say since the time, we're toddlers or could express emotion? It's like, oh, don't cry, don't be angry, oh, it's going to be okay. And people are generally so uncomfortable with the expression of emotions like that they try to stop it. They're like, oh, just calm down. It'll be okay. It'll be okay. It's an immediate like stop as opposed to allowing us to process and release. And that's our job, right? That is part of our job. And so allow that to happen without taking it on yourself. And you got to do whatever you can in your mind. If you got to whistle Dixie in your mind or think of something happy, rainbows and puppies or whatever it is, you think of whatever you need to kind of draw that back, and create that boundary. And in your mind, just remember, you got to help them. You got to help them. It could be helpful to have a little mantra of that, like, stop, don't make it about you. Don't make it about you. And obviously that's not our intention. We're just sympathizing with them. Right. And that is a good thing, but we just can't take it to the level where we're now breaking down and they don't feel like we can handle what they're telling us, because that defeats the whole purpose of even coming to therapy. So I can tell you one of my biggest, and well, let me go back, because even when I was did the episode about starting your career at these very intense environments like a prison or a inpatient, severely mentally ill facility or something like that, it will desensitize you to a lot. And that's a good thing for us. And so, but I'll share my biggest thing that I still have problems with today is, is with animals. any sort of like abuse or, I don't know, neglect, death, I mean, that's really what triggers me, and just my heart can't even take it. And since I've been desensitized to all these other things, I've done, child abuse and neglect evaluations, and I've had, I was in charge of a sex offender program, and I worked with inmates that had that life without parole for murder. So I've heard all of this stuff for so many years that I can hear all that stuff, surprisingly, and it really doesn't affect me anymore. And so and that might sound cold, but that's just maintaining that professionalism, and then I'm able to help the client more because I'm not so caught up in that piece of it, right? And then I can do the work with them. So but it took me so long to get over the anything with animals. And I remember early on in my career, there was a time that I was like, I even said to a client, like, I don't think I can hear this. And I thought, wow, if a therapist can't handle what you're saying, who can? I've regardless, I have to do my own work and put that aside for the betterment, for the client's best interest, to be able to help them, especially if they're the ones that are doing something. Those are the ones you want to help even more so they can stop doing that. So I had to try to do my own work, right? That's that counter transference from my end that was coming through. The client was triggering something within me. I had to do that work myself and try to reframe it in a different way. So anyway, that stuff will happen, and this is all normal, and it's part of the process in us just evolving and growing and becoming better and better, and that's the goal, right? Hope this helps. Bye.